Hello, Congressman Correa. I appreciate you taking the time to meet with me today. Additionally, I would like to extend my thanks to you for calling for increased oversight of medical aid and dying for those under hospice care. I sincerely believe that you want all patients to receive end-of-life care in a compassionate and non-discriminatory manner. My name is Jonas Civilio. I've been a registered nurse for 16 years, and I've worked at an inpatient psychiatric hospital since 2019. Currently, I am studying to become a psychiatric mental health nurse practitioner. I'm here today because I believe that there is a very specific safeguard that is unfortunately missing when we talk about medical aid in dying. I believe that as healthcare providers, we have not devised a consistent approach in determining if psychiatric stressors are affecting whether or not a person can make such an irreversible decision as ending their own life on their own terms. At my current position, I evaluate and assess patients on a daily basis. I then determine if their current thoughts, emotions, or behaviors place them at risk of harming themselves or others. It is one of my finest skills. One thing I've learned over the past 7 years is that despite a person being outwardly calm and composed, well organized with appropriate affect and thought processes, they may still be harboring severe depression, suicidal ideation, visual or auditory hallucinations, or delusional thought processes. The presence of one or all of these factors in a patient undoubtedly can affect a person's judgment. I do believe that those who possess a solid decision-making capacity should maintain autonomy, especially when enacting MAID. I also don't believe that being diagnosed with a psychiatric condition should automatically prevent patients from choosing to initiate MAID. My biggest concern is the fact that our current system in California does not utilize routine psychiatric evaluations by trained specialists to determine if a patient is of sound enough mind to make such an irreversible decision. Let's think about this for a moment. Let's say there's a patient who has been diagnosed with end-stage terminal cancer. He understands his prognosis is grim. He thinks of his family and the sacrifices they have made throughout his treatment. After doing some research, he decides to initiate MAID. Is his decision well thought out and utilizing full autonomy? Is it based on severe underlying depression, misplaced guilt, poor self-esteem, or even possible coercion? I have seen several of my family members battle cancer. Some fought hard and won, currently in full remission. Shout out to my Auntie Linda. On the other hand, I've had family members who weren't as fortunate, such as my father Ray, who died of stage 4 pancreatic cancer a little over 2 months after being diagnosed. Regardless of the prognosis, it was important to me that people such as my Auntie Linda and my dad maintained full autonomy and made their own decisions involving their treatment. However, if either my aunt or my father determined that MAID was their only option, I would still believe that a proper psychiatric evaluation is necessary prior to initiation. I wish this not to limit their decision-making ability, but to determine if the decision is truly theirs. However, I understand that further research is necessary prior to initiating protocols that could possibly delay treatment. So, Congress Korea, what exactly am I asking for? I'm asking that you expand your current work regarding MAID oversight by requesting that the Department of Health and Human Services and the Center for Medicare and Medicaid Services collect standardized data on decisional-making capacity and psychiatric well-being on Medicare hospice patients who initiate MAID. I would want data to reflect whether a patient was screened for such psychiatric conditions as suicidality, severe depression, impaired cognition, or coercion. I would like to know if a psychiatric or psychological evaluation was ordered and what factors triggered clinicians to request it. And if a psychiatric evaluation was ordered, I would like to know if there are any delays or barriers in completing this evaluation. This doesn't mean that I'm asking you to decide who can choose MAID and who cannot. I'm simply asking for more data to determine if my ultimate request is necessary. I have reviewed a study from a California medical center that determined that mandatory psychiatric assessments did not identify any patients who lacked decision-making skills, but I also don't think that data from one study is sufficient evidence. I also understand that New York is working on implementing mental health evaluation for all MAID applicants. They must have some other data that necessitated mandatory psychiatric assessments, something that we just haven't seen on our coast yet. I would like you to request this data so we have a broader picture and full understanding of the entire situation. Thank you for meeting with me, Congressman Correa. I prepared a one-page briefing of my recommendations and would like to follow up with you in the future.